I want to start today by putting something on the table. Metaphorically, I mean.
Right, because our actual table is just covered in coffee cups right now.
Exactly. No, I want you, our listener, to picture a manuscript.
Yeah.
Just a literal stack of papers, maybe 50 or 60 pages thick.
Heavy stock paper. The real deal.
Yeah. And it's filled with charts, p-values, those complex Kaplan-Meier curves, all the really dense, heavy lifting of a rigorous scientific study.
And this isn't just some rough draft, you know. It's not a scribble on a napkin. This is a finished, polished product.
Right. It was conducted at one of the most prestigious medical institutions in the United States, Henry Ford Health. It was led by their division head of infectious disease, a guy who was about as mainstream and, frankly, respected as they come.
It's been peer-reviewed internally. It's been stress-tested, signed off on by the authors. It is ready for the world.
It answers a question that parents, that doctors, that politicians have been screaming about for decades.
Yeah.
It literally has the potential to change how we look at modern pediatric medicine.
And here's the hook. It's sitting in a drawer.
It is a ghost. It exists. But we, the public, aren't supposed to see it.
And the reason we aren't supposed to see it is exactly why we're doing this deep dive today.
Today, we're unpacking the story of the hidden manuscript. We are pulling from a really fascinating source documentary called An Inconvenient Study.
Produced by Del Bigtree and his investigative team over at the Highwire.
Yeah, and they actually managed to get their hands on this unpublished data from Henry Ford Health up in Michigan.
Now, we should be very clear right out of the gate here. The data we're going to discuss today touches the absolute third rail of public health.
Vaccination.
Exactly. Comparing the health outcomes of vaccinated versus unvaccinated children.
And usually, when you bring up this topic, the conversation just shuts down. It doesn't even start. People get labeled. The yelling begins.
It becomes incredibly tribal.
Right. But our mission today is very different. We are not here to scream. We aren't here to tell you, the listener, that this study is the absolute final truth of the universe.
No, our job today is to act as independent auditors. We are going to take the source material provided to us, look at the raw data found in this specific unpublished study, and just break it down.
We're going to look at the numbers, which I have to admit, when I first read through the prep for this, were jarring. We're talking about a 4.29-fold increase in asthma, a nearly 6-fold increase in autoimmune disease among the vaccinated cohort in this data.
And we're also going to look closely at the statistical methods they use to defend those numbers, because you have to ask, is the math real?
But maybe most importantly, we're going to look at the human element. The scientist at the center of all this, Dr. Marcus Zervos.
His situation it's just a profound ethical dilemma.
It is the ultimate conflict between public health transparency and professional survival.
The source material calls it the Galileo moment. If you find data that contradicts the established narrative, do you speak up and risk total professional destruction? Or do you just stay quiet?
So buckle up. We are going to get into the weeds today. We're talking time-to-event analysis, hazard ratios, and institutional politics.
It's a heavy one, but an important one. Let's dive in.
All right. To really understand why this manuscript is such a massive deal and why someone would be terrified to publish it, we have to start by looking at the world we're living in right now.
The broader context.
Right. The source material paints this picture of the health landscape for American kids. And honestly, seeing the numbers laid out chronologically, it's staggering.
If you think back to the late 1970s or the 80s.
Which really wasn't that long ago.
It wasn't. The classroom looked very different health-wise. The source cites a stat that back then, about 12.8% of children had some form of chronic disease.
12.8%. So roughly 1 in 8 kids.
Right. And back then, a chronic disease might mean something relatively manageable, or maybe a mild allergy.
But fast forward to today. What is that number now?
Over 54%.
Over half. I mean, more than half of the kids in this country. We've shifted from a nation of generally healthy children to a nation of managed illness.
And these aren't just sniffles. We are talking about severe, life-altering diagnoses. The source lists them out. We're seeing massive spikes in ADHD, severe eczema, plaque psoriasis, rheumatoid arthritis, lupus, Crohn's disease.
And obviously the explosion in autism.
That's the one that gets the most media attention, absolutely. The source notes a shift from 1 in 10,000 kids, which is essentially a rare medical anomaly, to 1 in 31 today.
1 in 31. And look, whenever you bring that up, The immediate defense is always the same. People say, oh, we're just better at diagnosing it now, or doctors just have better awareness.
Or they bring up the genetic argument. They say, we're just finally mapping the genes responsible for these conditions.
Right. But the source makes a really rigorous counter-argument here that we have to talk about. Genetics simply do not work that fast.
They don't. A genetic mutation of that scale requires centuries to propagate through a population. Honestly, millennia.
You don't get a genetic shift that causes a 54% chronic illness rate in 40 years. It is biologically impossible.
So, if the human genome hasn't drastically mutated since the 1980s, the only logical conclusion is an environmental trigger. Something changed in what we eat, what we breathe, or what we put into our bodies.
And this is exactly where the source pivots to the childhood vaccine schedule. Now, I want to be really precise here. The source isn't claiming vaccines are the singular only change in the modern world.
No, we have microplastics, processed foods, all sorts of things.
Exactly. But they are arguing that the expansion of the vaccine schedule is one of the most significant universal medical interventions introduced during that exact same time frame.
And their core argument is that we have never properly evaluated the cumulative long-term cost of that expansion.
Which brings us to this concept they call the safety gap. To explain this, the source uses an analogy that I honestly thought was brilliant. It completely reframed how I think about this. The whiskey versus vodka analogy.
It's a great way to explain a very dry technical problem with clinical trials.
Walk us through it, because I think most people, me included, before I read this, assume that when a new vaccine is approved by the FDA, it's been tested just like any other drug on the market.
Right. People assume you take the new drug, you take a sugar pill, an inert placebo like saline, and you compare the two groups.
That's the gold standard, right? The randomized controlled trial.
Exactly. So in the analogy, if you want to test if drinking whiskey causes car accidents, you get two groups. Group A drinks a bottle of whiskey. Group B drinks a bottle of water.
Just simple enough.
Then you send them out on a driving course. If the whiskey group crashes into all the cones and the water group drives perfectly, you have definitive proof that the whiskey caused the impairment.
But the source highlights a critical, often misunderstood distinction. Vaccines are almost never tested against a water placebo in their pre-licensing safety trials.
Almost never. Instead, they use what the industry calls an active comparator.
So, sticking with our analogy, how does that work?
Instead of testing the new whiskey against water, they test it against vodka, or maybe a previous, already approved version of whiskey.
Okay, so Group A drinks the new whiskey, Group B drinks the vodka, and they both go out and crash their cars on the test track.
Yes. And because the crash rate is basically the same in both groups, the researchers write down in their conclusion, the new whiskey is safe.
Because it's no more dangerous than the vodka.
Exactly. The regulatory logic is, well, we already know vodka is safe, or at least accepted, so if the new whiskey behaves similarly, it must also be safe.
But you've completely lost the baseline. You never compared it to sobriety.
You never compared it to a group that had absolutely zero intervention.
And the source backs this up with a really specific piece of evidence that blew my mind. They reference a legal deposition from Dr. Stanley Plotkin. For our listeners who might not be deep into this world, who is Dr. Plotkin?
Dr. Plotkin is essentially a titan in vaccinology. People call him the godfather of vaccines. He developed the rubella vaccine. He literally wrote the textbook called Vaccines that is standard issue in medical schools worldwide.
He is the authority.
Without question. So in this legal deposition, which he is giving under oath, the lawyer asks him about the clinical safety trials for the hepatitis B vaccine. This is a shot given to newborns, usually on their first day of life.
And the lawyer asks him, how long was the safety monitoring period? Like, how many days did they watch these babies to see if there were adverse reactions?
And Dr. Plotkin's answer under oath was 5 days.
5 days. I have to pause on that.
It's hard to process.
We are talking about a medical intervention given to an infant.
Yeah.
And they only checked for safety signals for less than a week.
That is what the deposition reveals. And crucially, there was no saline placebo control group in that trial. So let's say a child developed a neurological issue or a severe rash or stopped making eye contact 3 weeks later.
It wouldn't even be recorded in the trial data.
It wouldn't exist as far as the official safety profile is concerned. The trial was already over. It would just be logged by a pediatrician somewhere as a coincidence.
I mean, if I'm a parent, I assume safety tested means they looked for long-term issues. Autoimmune diseases do not develop in 48 hours.
And this is the exact crux of the safety gap argument. Because we rely on these short-term trials with active comparators instead of true placebos, we have a massive systemic blind spot for long-term chronic illness.
But Plotkin had a defense for this, didn't he? It wasn't just laziness. He cited an ethical constraint.
He did, and to be fair, this is the standard defense across the entire industry. The argument is that conducting a true saline placebo trial today would be highly unethical.
You'd be denying care.
Right. If the medical consensus is that a vaccine prevents a deadly disease like measles or polio, you cannot ethically take a group of children, give them a fake shot, and leave them vulnerable just to see if they end up with fewer allergies a decade later.
Okay, I follow the logic. No doctor wants to let a kid get a preventable disease just to satisfy a statistician. But that logic creates a massive circular trap.
A total catch-22. You can't do the placebo study because it's unethical to withhold the vaccine, but because you never did the placebo study, you don't actually know if the cumulative schedule is causing long-term harms that might rival the diseases you're preventing.
You are assuming total safety based on an absence of evidence, while simultaneously arguing that it's unethical to gather that evidence.
Exactly.
So if we can't do a randomized controlled trial, if we can't just take 1,000 babies and give half of them saline, are we just stuck? Is there literally no scientific way to answer the question?
The source argues there is a way. In fact, it's the only ethical way left. You have to conduct a retrospective cohort study.
Which means looking backward at data that already exists.
Right. You aren't experimenting on anyone. You aren't assigning kids to a water group or a whiskey group. You simply look at the choices parents have already made in the real world.
Because there are millions of kids in the U.S. Some parents follow the full schedule, some do a delayed schedule, and a growing number choose to remain completely unvaccinated.
So you find a comprehensive database that tracks all these kids, and you just objectively compare their health outcomes. It's an audit, not an experiment.
And that perfectly sets the stage for our story, because for years, federal agencies have claimed that doing this kind of study is impossible. They say the data is too messy, or you can't track down enough completely unvaccinated kids to make a statistically valid control group.
But the Source documentary reveals that this data does exist, and the gold mine was found at Henry Ford Health.
Let's talk about Henry Ford Health. It's a massive institution in Michigan. But why is their data so much better than, say, a huge hospital in New York or Chicago?
Because Henry Ford is what's known as an integrated health system. Think of it like a giant HMO.
Meaning they are the doctor and the insurance company rolled into one.
Exactly, and that is vital for data integrity. In a normal, fragmented healthcare system, you might take your kid to a pediatrician for a checkup, but then go to an out-of-network urgent care for an ear infection, and then see a private specialist for asthma.
The records are scattered everywhere.
Right, but in an integrated system like Henry Ford, everything happens in-house. They track that child from the day they are born. Every single well visit, every prescription filled at the pharmacy, every ER trip, it is all contained in one captive, centralized database.
Which eliminates one of the biggest problems in retrospective studies, recall bias.
Yes. Recall bias is when you try to do a study by just calling up parents and asking, hey, did your kid have eczema when they were 3? Human memory is terrible.
But with this database, you aren't relying on memory. You were looking at hard billing codes.
If the child was diagnosed, it generated a code. If it generated a code, it's permanently in the data. It is widely considered the absolute gold standard for real-world medical evidence.
Okay, so the team at the Highwire knows this database exists, but they can't just hack into it. They need a credentialed inside scientist to run the numbers. Enter Dr. Marcus Zervos.
Dr. Zervos is the pivotal character in this entire narrative, and we really need to establish his background because critics of this topic will often try to paint anyone who questions vaccine safety as a fringe pseudoscience quack.
But Zervos is the polar opposite of fringe.
He is the establishment. He is the division head of infectious disease at Henry Ford. But beyond his titles, the source highlights his track record of genuine scientific integrity.
They bring up his involvement in the Flint water crisis.
Yes, and that is a crucial detail. During the Flint crisis, there was an outbreak of Legionnaire's disease. And the state health officials were actively trying to downplay it. They were basically telling the public not to panic, telling reporters people have to die of something.
Disgusting. And what did Zervos do?
He stood up to them. He went totally against the political grain of his own state. He looked at the data, saw that people were dying from the water, and he refused to be quiet. He acted as a whistleblower for public health.
So he has a history of a very strong moral compass.
He does. He also caught some heat during the COVID pandemic. He co-authored a study suggesting hydroxychloroquine actually reduced mortality in certain hospitalized patients.
Which was a massively unpopular stance at the time.
Extremely unpopular, but again, it shows his character. He is willing to follow the data, even if it leads him straight into a political firestorm.
But, and this is so important to remember as we get into his findings, Dr. Zervos is absolutely not anti-vaccine.
Not even a little bit. In the hidden camera footage provided by the source, he states very clearly that he is pro-vaccine. He promotes them, he mandates them for his own staff, he firmly believes in the system.
So when Del Bigtree's team approached him to run this comparison study, Zervos didn't sign on to destroy the childhood schedule.
I think it's highly likely he thought he was going to vindicate the schedule. He probably figured, great, I have the best database in the world, I'll run the numbers, I'll prove that the unvaccinated kids are actually much sicker, or at least that the differences are statistically negligible, and we can finally put this whole anti-vax debate to bed.
He thought he was going to be the hero who proved the skeptics wrong with hard data.
He trusted the scientific method.
All right, so he pulls the records, he runs the study, and what he finds, well, it clearly wasn't what he expected to find. Let's dig into the actual data. Section 3 of our deep dive. What were the parameters?
The study cohort was massive. They looked at 18,468 children total.
And out of that huge group, how many were completely unvaccinated?
1,957.
Nearly 2,000 kids. I want to highlight that because the usual dismissal of these retrospective studies is that you can never find enough unvaccinated kids to form a statistically significant control group.
Right. If you only have 40 or 50 unvaccinated kids, you can't draw any firm conclusions. The margin of error is too wide. But 2,000 kids, that gives you real, undeniable statistical power.
And what metric were they using to compare these two groups?
They used a time-to-event analysis. This is important because it doesn't just measure if a child ever got sick. It measures how quickly they got sick after birth, generating a relative risk ratio between the two groups over time.
Okay, I'm ready. Walk me through the signal. What did this study actually find?
Let's start with the broad top-line finding. Across all tracked categories, vaccinated children were roughly 2.5 times more likely to be diagnosed with a chronic health condition than the completely unvaccinated children.
2.5 times. So more than double the overall risk of becoming chronically ill.
Correct. But that is just the average. When you drill down into the specific conditions, the numbers jump from concerning to genuinely explosive. Let's look at asthma first.
Asthma is everywhere. I feel like half the kids in my neighborhood have an inhaler.
In this specific data set, after adjusting for variables, they found a 4.29-fold increase in asthma among the vaccinated kids.
Wait, 4.29.
A vaccinated child was over 4 times as likely to develop asthma compared to an unvaccinated child in the same health system.
To put that in context for us, what is considered a bad signal in epidemiology? Like if we were studying a new food dye in cancer, what number makes the FDA panic?
Generally, a relative risk ratio of 2.0, a strict doubling of risk, is considered a massive screaming red flag. That is the threshold where you halt trials, stop the production line, and launch a federal investigation.
And here we are looking at more than double that panic threshold just for asthma.
Right. And as you know, asthma isn't just a minor inconvenience. It causes emergency room visits. It requires daily steroids. It severely impacts a child's quality of life.
But asthma isn't even the highest number they found, is it?
No. If the asthma number is bad, the autoimmune data is terrifying.
Autoimmune disease. This is where the body's immune system gets confused and basically starts attacking its own healthy tissue.
Exactly. We are talking about severe conditions. Thrombocytopenic purpura, rheumatoid arthritis, systemic lupus erythematosus, multiple sclerosis.
These are heavy, lifelong, debilitating diseases.
The study found a nearly 6-fold increase in autoimmune conditions, specifically a 5 times higher risk in the vaccinated group.
Almost 6 times the risk.
Think about it like rolling a standard die. If you are an unvaccinated child in this cohort, you have to roll a 6 to get an autoimmune disease. If you are a vaccinated child, you get the disease if you roll a 1, 2, 3, 4, 5, or 6.
That analogy is chilling because if that number translates to the broader population, if we have a medical intervention that increases the risk of autoimmunity by almost 600% and we mandate it for 95% of the population,
then you get a generation where 54% of kids have a chronic illness. The math of this study perfectly mirrors the reality we're seeing in our elementary schools.
What about neurodevelopmental issues? Did they track things like speech delays and motor function?
They did, and it follows the exact same pattern. Overall, the risk for neurodevelopmental disorders was 5.5 times higher.
Right.
Breaking that down, speech disorders specifically were 4.47 times higher. Motor disability problems with physical coordination and movement were nearly 3 times higher at 2.92.
Are there any categories where the vaccinated kids actually did better? Or
Mm.
they had fewer chronic issues?
In terms of the chronic illness metrics tracked by this data set, no. The signal of harm is consistent across the board.
And then there's what the source calls the zero list. When I was reviewing the notes for this, I honestly had to reread this section because I thought it was a typo.
It is definitely not a typo, but it is shocking. There were several major chronic conditions where the unvaccinated control group had 0 cases.
Out of almost 2,000 kids.
0 cases of ADHD.
Stop right there. ADHD is absolutely ubiquitous today. You are telling me that in a randomly captured group of 2,000 unvaccinated children in Michigan, not a single one had an ADHD diagnosis?
Not one. Meanwhile, in the vaccinated group,
Yeah.
262 cases.
262 versus 0.
And the list goes on. 0 cases of diabetes in the unvaxxed. 0 behavioral problems. 0 learning disabilities. 0 tics. 0 intellectual disabilities.
That seems almost statistically impossible. Even if you firmly believe vaccines cause these issues, shouldn't there be a natural background rate? Shouldn't just one kid have ADHD by pure genetic bad luck?
You would certainly expect some background noise. The fact that the result is an absolute 0 is what makes it so statistically powerful. When you try to calculate a risk ratio against 0, you basically get infinite risk. You can't divide by 0.
Right.
What this suggests to researchers is that for these specific conditions, the environmental trigger, whatever it is, might be the primary overriding driver. Without that specific trigger, the condition essentially does not manifest at all in the specific cohort.
That is a bombshell finding. But we have to address the elephant in the room. The one finding that didn't neatly fit this pattern. The one condition that everyone fights about constantly. Autism.
Yes, and this requires some very careful nuance. The study found that the link to autism was not statistically significant.
Okay, so if this study ever did get published, the New York Times headline would instantly be, "New study finds no link between vaccines and autism."
That is 100% how the PR firms would spin it, but we are acting as auditors today, which means we have to look at the actual numbers behind that conclusion.
What were the raw numbers for autism?
There were 23 cases of diagnosed autism in the vaccinated group. There was 1 case in the unvaccinated group.
23 to 1. I mean, just looking at that as a layman, that seems like a massive difference. That's 23 times more cases?
It is a massive physical ratio, but we are dealing with the strict mathematical rules of epidemiology here. Because there was only 1 single child in the control group with the diagnosis, the sample size for that specific condition was deemed too small to be statistically significant.
This is what they call an issue of statistical power.
Exactly. Dr. Zervos actually explains this perfectly in the hidden camera footage. He says, look, we simply didn't have enough power to prove the autism connection. It doesn't mean the link isn't real. It doesn't actively disprove it. It simply means that in this specific group, having only 1 case on the unvaxxed side made the math technically neutral.
It didn't reach the p-value.
Right. But Zervos points out a crucial context. He says you cannot look at that autism finding in total isolation.
Because it's part of a larger category.
Yes, autism is a neurodevelopmental disorder.
Mhm.
And if you look at the broader neurodevelopmental category, the speech delays, the motor skill deficits, that category was highly statistically significant at 5.5 times the risk.
So autism is just one specific point on a spectrum that is entirely flashing red.
Exactly. If the rest of the spectrum shows a massive signal, the autism numbers are almost certainly part of that same signal, even if the strict math on that one subdiagnosis fell just short of the arbitrary significance line.
Okay, so we have all this data on the table. If I am a hostile critic or if I'm a peer reviewer at a major medical journal, my immediate instinct is going to be to pare this methodology to shreds. I'm going to look for any excuse to throw it out.
And that is a valid part of the scientific process.
The most common attack on retrospective studies is the old saying, correlation does not equal causation.
Right. Just because the rooster crows right before the sun comes up doesn't mean the rooster caused the sun to rise.
So let's go through the technical defense, which is section 4 of our deep dive. The main weapon critics use against these specific vax versus unvaxxed studies is something called healthcare-seeking behavior.
Also known as the healthy user bias, or, more bluntly, the head in the sand theory.
Explain how that argument works.
The critics will argue, look, parents who choose not to vaccinate their kids generally harbor a deep distrust of the medical establishment.
Which is a fair assumption.
It is. So the theory goes, when their unvaccinated child develops asthma or shows signs of autism, those parents simply don't take them to the doctor. They treat it at home with diet changes or essential oils.
So the kid actually has the disease, it just never gets entered into the Henry Ford billing system.
Exactly. The critics argue the unvaccinated kids only look healthier on paper because they are chronically undiagnosed.
It's a very strong logical counter-argument.
It is, and Dr. Zervos, being a veteran researcher, knew this would be the very first weapon the journals would use against him. So he and his statistical team performed what's called a sensitivity analysis.
Break that down for us. What does that actually mean in practice?
Basically, they decided to stress test their own data. They said, okay, let's assume the critics are completely right about the head in the sand theory. Let's filter our database to correct for it. They removed all the children from the study who rarely or never went to the doctor. So they only kept the high utilizers.
Right. They only looked at the kids in both groups who had regular documented pediatric checkups. Kids who came in for broken arms, for the flu, for standard physicals. They leveled the playing field based on visit frequency.
So now we are comparing vaccinated kids who go to the doctor regularly against unvaccinated kids who also go to the doctor regularly.
Precisely. If the head in the sand theory was the real reason behind the numbers, filtering the data this way should make the signal disappear. The unvaccinated kids who visit the doctor all the time should suddenly show up with massive rates of asthma and autoimmunity.
And what happened when they ran that filtered data?
The signal held. It didn't vanish at all. The unvaccinated children who regularly utilized healthcare were still dramatically, profoundly healthier than the vaccinated children who utilized healthcare.
So that completely neutralizes the undiagnosed argument.
It kills it. They also adjusted for a bunch of other variables they call confounders, the usual demographic suspects. Poverty levels, race, gender, where the kids live.
Yes. They used a complex statistical model called Cox proportional hazards to adjust for all of that. And Zervos admits on camera that he fully expected these adjustments to make the scary findings go away.
He wanted the math to give him an out.
He really did. He thought maybe the vaccinated kids just skew poorer, or maybe they live in more industrial zip codes with worse air quality.
But the math didn't care about the zip codes.
No. The impact of the socioeconomic adjustments was negligible. The primary driver of the chronic illness was undeniably the vaccination status.
There was one other stress test they did that I found really compelling. It had to do with time, the follow-up duration.
This is a fascinating layer. They cut the data to look at the health outcomes of the kids at different age milestones. After 1 year, after 3 years, and after 5 years of life.
And what was the trend?
They found that the relative risk actually increased over time.
Meaning the older the kids got, the wider the health gap became.
Yes. At 1 year of age, the risk of chronic illness for a vaccinated child was roughly 2.75 times higher. But by age 5, that risk factor had grown to 4 times higher.
So it's a cumulative effect.
It strongly suggests a divergence. These aren't just acute one-time allergic reactions happening right after the shot. The two groups of children are traveling on fundamentally different physiological trajectories. And the further along they travel, the more obvious the damage becomes.
Okay, so Dr. Zervos has looked at all of this. He applied every statistical stress test known to modern medicine. He tried to break his own study. And in that hidden camera footage, what is his final verdict on his own work?
He calls the study solid. He says to the camera, we looked at it sideways, backwards, and every other way to find a flaw. He openly admits he wanted to find a flaw to make the problem go away. But he couldn't. He says the data is the data.
Which brings us to Section 5, the most uncomfortable and frankly depressing part of this deep dive, the ethical dilemma.
It really is a tragedy.
Because we have a remarkably solid study, we have a highly respected mainstream scientist, we have a pristine gold standard database, and yet this manuscript is not published on PubMed. It's not featured in the New England Journal of Medicine. It is locked in a drawer.
The scene in the documentary where they reveal this is just, it stays with you. It's a dinner meeting. Del Bigtree is sitting across the table from Dr. Zervos, and it's being recorded on a hidden camera.
And Big Tree is pushing him hard. He's pleading with him, saying, you have the evidence. You have the absolute proof. You have a moral obligation to publish this. The world needs to know what is happening to these kids.
And the incredible thing is, Zervos doesn't argue with him about the science. He doesn't say, well, Del, the data is inconclusive.
Yeah.
He explicitly agrees. He says it is important information. He even says, and this is a direct quote from a top infectious disease doctor, we are systematically making kids sick.
Just let that sink in for a second. We are systematically making kids sick. That isn't a blogger saying that.
Yeah.
That is the division head at Henry Ford Health.
It is a devastating confession. But immediately after he says it, comes the reality check. Zervos looks at Bigtree and says, if I publish this data, I might as well retire. I would be finished.
He is absolutely terrified.
He is looking at the totality of his life. His pension, his reputation, his ability to ever work in medicine again. He talks about the political agenda surrounding vaccines. He mentions how his own PR team at Henry Ford warned him against it.
What did the PR team tell him?
They told him, Marcus, even if you go on CNN and explain the nuances of this data perfectly, the media will twist your words. They will label you a dangerous anti-vaxxer, and they will completely destroy your credibility overnight.
And Zervos makes a very pragmatic, almost cynical argument to defend his silence, doesn't he?
He does. He says publishing one rogue study is not going to change the massive medical industrial system. The system will simply ignore the data and destroy the messenger.
It's the ultimate whistleblower's dilemma.
Yeah.
If he speaks up, he loses everything he's built, and the machine just grinds him into dust and keeps moving anyway.
He actually cites specific historical examples to justify his fear. He knows what happens. He brings up Dr. Paul Thomas.
Tell us about Dr. Thomas. What happened to him?
Dr. Paul Thomas was a very successful, highly respected pediatrician operating a massive clinic in Oregon. He was noticing these same trends in his own patients, so he hired an independent statistician to run a retrospective study on his clinic's data, over 3,000 kids.
And he published it.
He formally published it in a peer-reviewed journal. And his data showed the exact same signals we are talking about today. The unvaccinated children in his practice were remarkably healthier across almost every metric.
And how did the medical establishment react to his published data? Did they debate his methods?
No, they didn't debate the data at all. The Oregon Medical Board convened and suspended his medical license on an emergency basis. They publicly labeled him an immediate danger to the public.
They attacked the man, not the math.
Exactly. They destroyed his entire practice, forced him out of his own clinic, and bankrupted him with legal fees.
And the source mentions another guy, Dr. Mawson.
Yes, Dr. Anthony Mawson. He ran a similar comparative study looking at homeschool children who have a much higher rate of being unvaccinated. He found the exact same chronic illness signals, and his career was systematically dragged through the mud.
So Zervos knows this dark history. He knows that in this highly specific field of medicine, scientific truth is secondary to federal policy. If the science contradicts the established policy, the science and the scientists who found it must be eradicated.
It's heartbreaking because watching that footage, you can see the visceral conflict in Zervos' face. He knows exactly what the morally right thing to do is, but he also knows what the professionally smart thing to do is.
And look, sitting here in a studio, it is really easy for us to judge him. It's easy to say, be a hero, burn your life down for the greater good.
Yeah.
But when it's your actual mortgage on the line, your legacy, your colleagues shunning you in the hallways, fear is an incredibly powerful silencer.
It is. Most people would choose self-preservation.
I do want to touch on Henry Ford Health's official response to all of this, because the documentary team did reach out to the institution directly.
They did. And Henry Ford responded with a very aggressive cease and desist letter, standard corporate legal intimidation. But inside that letter, they claimed that the unpublished study had, quote, significant and serious flaws, and that it failed to meet their rigorous internal standards.
Which is just a breathtaking contradiction to what the actual lead author of the study told them in private.
It is the definition of institutional gaslighting. The lead scientist, Dr. Zervos, says it's solid, and they checked it every possible way. The corporate lawyers say it's fatally flawed.
They are actively rewriting the reality of the document to legally justify keeping it buried.
Exactly.
So Zervos is successfully silenced. The manuscript is dead in the water. But that leads us to Section 6, the broader implications. Does this massive signal exist anywhere else? Or is this just some weird statistical anomaly isolated to Michigan?
That is the most concerning part of this whole deep dive. It is not an anomaly. It perfectly fits a pattern of evidence that has been quietly emerging for decades, mostly from researchers outside of the United States who are slightly less controlled by our specific pharmaceutical politics.
The source spends some time talking about Dr. Peter Aby.
Yes, Dr. Aby is a crucial piece of this puzzle. He is a world-renowned Danish researcher. And to be clear, he is not anti-vaccine. He has literally spent his life running vaccination programs in developing nations in Africa.
But he noticed something in his data back in the late 70s and 80s, right? When they introduced the DTP vaccine in Guinea-Bissau.
The DTP is the diphtheria, tetanus, and pertussis shot. Dr. Aby went in to study its effectiveness, and he found that the vaccine did exactly what it was supposed to do. It successfully prevented diphtheria, tetanus, and pertussis.
But there was a catch.
A massive, tragic catch. He discovered that the girls who received the DTP vaccine were dying at up to 5 times the rate of the completely unvaccinated girls.
Wait, 5 times higher mortality? If they weren't dying of diphtheria or tetanus, what were they dying from?
They were dying from everything else: pneumonia, sepsis, malaria, random viral infections.
Because their immune systems were compromised. This introduces the concept the source calls non-specific effects.
Right. Think of a child's immune system like a highly specialized training camp for soldiers. If you aggressively train that immune system to be hyper-focused on one specific rare enemy, let's say the measles virus, it might get incredibly good at fighting that one specific ninja.
But the trade-off is that it gets distracted.
Exactly. The defense gets skewed. So when a common street thug shows up like a standard pneumonia bacteria, the immune system doesn't know how to respond appropriately, and the child gets severely ill or dies.
You buy protection against disease X, but you pay for it with extreme vulnerability to disease Y.
Dr. Aby argues that Western medicine has never properly studied these nonspecific trade-offs. And what we are looking at in the Henry Ford data, the explosion of asthma, the massive spikes in autoimmunity, that is just the modern Western version of this exact same trade-off.
The kids in Michigan aren't dying of sepsis like the kids in Guinea-Bissau, but their immune systems are deeply skewed. They are hyperreactive, they are aggressively attacking harmless pollen, which is asthma, or they're attacking their own organs, which is autoimmunity.
The biological mechanism is the same.
And this brings up a really fascinating observation the source makes about the unvaccinated control group. The overarching narrative we are all taught is that unvaccinated children are essentially walking incubators of disease, that they are fragile and constantly sick.
Right, the media portrays them as a public health hazard.
But in the Henry Ford study, and in Paul Thomas's data, they appear shockingly healthy.
The time-to-event statistic at the 10-year mark is mind-blowing. At 10 years of age, 83% of the completely unvaccinated children in the Henry Ford database were totally free of any chronic illness.
83% were perfectly healthy.
Now compare that to the fully vaccinated group. At 10 years old, only 43% were illness-free.
That is a total inversion of what we are told to expect. You intervene with a medical product to presumably improve a child's health trajectory.
Yeah.
But according to this data, the product actively cuts your chance of being a healthy 10-year-old in half.
It completely challenges the fundamental assumption of modern pediatrics, which is that more medicine automatically equals better health. This data suggests that sometimes doing nothing is vastly superior.
So where do we actually go from here? Because Zervos is out of the game, he isn't going to publish. Henry Ford Health is threatening anyone who talks about it. The study is dead.
The specific manuscript might be dead, but the raw data isn't. And this is the ultimate call to action presented by the source material. Henry Ford is not the only integrated HMO in the country with this kind of captive database.
Right. Earlier you mentioned places like Kaiser Permanente.
Kaiser Permanente, Harvard Pilgrim, the Mayo Clinic. They all have millions of patients and pristine cradle-to-grave coding data. But most importantly, the CDC itself has this data.
They run something called the VST, right?
The Vaccine Safety Data Link. It is a massive, federally funded network of linked databases from huge HMOs all across America. It covers millions upon millions of children.
Because the CDC has the technical ability, literally right now, today, to run this exact same comparative query.
They could run the code this afternoon. They could push a button and compare vaccinated versus unvaccinated kids for asthma, for autism, for lupus, for ADHD. They own the ultimate gold standard data set.
So why haven't they? If the goal is public health, why haven't they published that definitive study to reassure everyone?
Well, the grim argument made by the source is that the CDC likely has run that exact query internally. They just refuse to publish the results. Because If a mid-sized system like Henry Ford found a 4 times increase in asthma and a 6 times increase in autoimmunity, the VSD almost certainly shows the exact same catastrophic signal.
And if the federal government officially published data showing that they are systematically causing autoimmune disease?
It would instantly collapse the entire childhood schedule. It would be the greatest medical scandal in human history. The liability would be incalculable. So the silence is enforced. The data stays in the dark.
It really forces you to reconsider the definition of science.
Yeah.
I always grew up believing that science was about boldly asking questions, even the dangerous ones, especially the dangerous ones.
Real science is a method of ruthless inquiry. It is not a rigid set of beliefs. If an institution is terrified to ask a question because they cannot politically survive the answer, they are no longer practicing science. They are enforcing a dogma.
They are protecting a religion, not public health.
Exactly.
And in the meantime, while all these bureaucrats protect their pensions, we have an entire generation of children in crisis. We are raising the sickest generation in recorded history. And well-meaning parents are sitting in pediatrician offices every single day, signing consent forms.
Informed consent. That is the foundational legal and ethical standard of all modern medicine. You're supposed to be fully informed of the risks before taking a drug. But if the actual risks, the severe long-term chronic illness risks documented in these hidden studies, are intentionally kept secret from the public, can a parent ever truly give informed consent?
No, you can't. You're consenting to a carefully curated marketing brochure, not the actual scientific reality.
It's an illusion of consent.
As we wrap this up, I want to leave everyone listening with a final provocative thought. Picture Dr. Zervos at that dinner table again. By all accounts, he is a good man. He's a brilliant scientist who genuinely wants to help people,
Yeah.
but he is entirely trapped by the system he serves.
He looks at undeniable mathematical proof that we are harming children, and he effectively says, it's the right thing to do, but I just can't do it.
It is a profound tragedy. But I also think it serves as a wake-up call for the rest of us.
It has to be.
If the vodka versus whiskey testing standard is the absolute best the industry is willing to voluntarily give us, maybe it is finally time for us, the public, the parents, the voters, to demand the water trial.
It's time to demand the raw data, no matter how inconvenient or destructive that truth might be to the establishment.
This has been a really heavy deep dive today, but I honestly think it's one of the most important topics we've ever audited.
Absolutely. Keep asking the hard questions, and don't ever settle for the silence.
Thanks for listening, everyone. We'll see you next time.